Pennsylvanians desperately want health care for all. We have so many communities that are aggrieved, as there are around the country. October 20th, come to Harrisburg. Help us, help you, help us, help Pennsylvania model for the nation the single-payer solution. Because once we get it in Pennsylvania, all of our surrounding states, including our good friend Representative Kucinich's Ohio, can't get on, won't get on with single-payer fast enough. So thank you all for coming out today. Deeply grateful for all you do. Stay in touch. Thank you so much.
You're the ones who have made it possible for the American people to understand that health care is a basic right. You're the voice of that. You're the face of that. You're the action of that principle, that health care is a basic right. That understanding has not truly been visited upon this Capitol. There's still a dominating view that health care is a market-based activity, like all other activities within a capitalist system. It's not seen as being apart from activities on Wall Street, as being apart from profit and loss statements of insurance companies. Healthcare is seen as an essential element of a for-profit system. Indeed, as all of you know, $2.4 trillion a year is spent for healthcare, 16 to 17% of our gross domestic product. And if there's any question about the dimensions of this battle, it can be found in this simple statistic. And that is 1 out of every $3 goes for the activities of the for-profit system, or $800 billion a year in revenue for a combination of corporate profits, stock options, executive salaries, advertising, marketing, cost of paperwork. It's all wrapped up in there. This is why we're in such a struggle here in Washington right now. This present system has become so rigid with tens upon tens of millions of dollars of campaign contributions over the years. And the health of our people points to the necessity to reform the entire political system. This is why what you're embarked on and what we're embarked on here has such important implications for our country. We need to show people that the only real way to control costs and to make health care widely available and have your doctor of choice is through a single-payer system. We need to re-empower all those statewide movements. And we need to start ones where they do not yet exist. The second step is, in September, when this bill is brought forward, one of the amendments to H.R. 3200 in labor education, I was proud to offer, and it was passed, and that is an amendment that confirms that states will have the option to have single payer. Now, we need to protect that amendment. And the activities that need to occur in communication with congressional offices between now and that vote in September will be to protect the Kucinich amendment to H.R. 3200 that was in the labor and education bill that provides for a state single-payer option. We need to work on, in the next month, make this a national issue, preserving the Kucinich amendment to H.R. 3200. Okay, the third step, first we make sure that single-payer movement becomes healthy at the state level. We empower it and protect it through the amendment to 3200. The third step is we need to redouble our efforts towards a single-payer movement nationally, everywhere, as a national construct, no matter what happens with this bill. This bill could eventually fall of its own weight. There are so many compromises being made. People are compromising their compromises, which were already compromised. This is so compromised a bill. There's also the possibility the thing could go down. We have to be ready with the only solution that exists, and that is 676, the bill that John Conyers and I worked on together, that is the single-payer solution. We have to be the emissaries of truth here, and for the health of our people. Now, there's one final thing I want to mention, and that is, if we ever had a moment where we had any doubts about the imperative of public financing for federal political campaigns. This is the moment where we're reawakened about that again.